All right. We are Group C, here to talk about Mississippi County, a little bit about their health and some proposed programs to improve it. Mississippi County is in the far northeast corner of the state of Arkansas. Blytheville, Arkansas is their main population center. They have roughly 40,000 people in their population. Uh, Back in the day, agriculture was their primary economic driver, but it's now manufacturing, and it's predominantly steel. So Nucor and Big River Steel, which is a subsidiary of U.S. Steel, are the main plants there. It's actually one of the largest producers as a county of steel in America. But they've had a declining population over the last decade, which caused some problems. They have an increasing level of diversity from 2010 to 2022. In 2022, they have roughly 57% white population, 35% Black, 5% Hispanic, and that's shown in the donut chart up top right, the shift there in demographics. And then below, you can see that the 65 plus age band is the only population that actually has growth, which is a sign of an aging population.
All right, so I'm going to discuss the health status of Mississippi County. Some of the most significant problems that they face in this county is cancer, as well as the cancer mortality rate, respiratory illnesses and diseases, as well as heart disease. Some important behaviors and health conditions that contribute to some of these problems that many people in this county are dealing with is the smoking prevalence, as well as obesity. In this presentation, we're mostly touching on cancer and the smoking prevalence because those are so common with this population. The cancer prevalence in Mississippi County is 6%. But what's more concerning is the mortality rate itself of those in Mississippi County when they are diagnosed with cancer. The rate here is 211 per 100,000 people, which, as you can see, based on these numbers, is much, much higher than both the national cancer mortality rate as well as the Arkansas cancer mortality rate. Additionally, one of the reasons that we wanted to touch on smoking and come up with ideas to address this problem in this county is their smoking rate is 25%, which is much higher than the national average of 19%. Additionally, according to the CDC, smoking does cause about 1 in 3 cancer deaths in the US. So it's definitely something that we can look at that contributes to some of these health problems that they deal with here.
So for the health insurance coverage in Mississippi County, as you can see in the chart on the right, employer coverage and Medicaid are the highest percentages of coverage for the residents in Mississippi County at 38% and roughly 30%. A little bit lower is Medicare at 10.6%, non-group at 10.6%, uninsured at roughly 9.5%, and military and VA at almost 2%. You can see, as we discussed earlier, the aging population is growing in Mississippi County, so we can see that represented here with the higher Medicaid coverage. So the provider to resident ratio. So as of 2022, the ratio was 12.3 physicians per 10,000 residents. This is with a population of about over 40,000 and 50 active primary care physicians. And this ratio is compared to the state physician to resident ratio of 9.3 per 10,000 residents.
So there are a couple of healthcare facilities that those in Mississippi County can utilize. There are two main medical centers, Great River Medical Center as well as South Mississippi County Regional Medical Center. The Great River Medical Center is the much larger one. It's a full service hospital and has about 99 beds. And then the South Mississippi County Regional Medical Center is much smaller with only 25 beds, and it's a critical access hospital. There is another facility that is utilized by many of those who live in Mississippi County, the East Arkansas Family Health Center. This is a nonprofit health center that provides services to many different counties in this region, including Mississippi County. So it's not located in Mississippi County, but it is highly utilized by those who live in the area. It provides many services such as primary care, women's health, chronic disease management. It even provides dental care, ophthalmology, behavioral health, and pharmacy.
So now this is our proposed program for Mississippi County. So the first part of this program would be cancer screening clinics for the community. So ideally, this would be hosted by Mississippi County Health Department, and it would look something along the lines of free community screenings for residents, whether it is multiple times a year or just per, if in October they want to do breast cancer screening clinics, May or just summertime they want to do skin cancer screenings, September they want to do prostate screening clinics, something along those lines for residents to sign up. They can see a doctors or dermatologists who volunteer for these clinics. It would be a quick 5-10 minute appointment. They can evaluate any concerns. If there were any skin abnormalities that a resident was concerned with, or if there was like a lump in a breast, this is an easy way that residents can be seen by a doctor if for some reason they don't have one, or if they aren't covered by insurance, or if it's a long wait time, etc. This would help by getting residents that sort of peace of mind, whether something that they have is minor or if it's something that really needs to be evaluated. It'll be quick, easy, and free. It eliminates the hassle of making or waiting for a doctor's appointment, and it increases the secondary prevention method efforts as well as educating the importance of early cancer detection, which, as we all know, that is a very important aspect to cancer.
Another piece of the programming that we want to do is community education. So we would want to work with companies in Mississippi County to run workshops with their employees. In these workshops, we would hope to emphasize the importance of primary care and regular screenings and checkups, as well as provide contact information for local practitioners. Sometimes people just don't know where to start when it comes to healthcare. So just by providing contact information and like telling them where they can go for these screenings would be a huge help. In these workshops, it would also be important to explain behaviors that put their health at risk, as well as educate on the dangers of smoking and provide methods and strategies to quit since it is so prevalent in this region. Another part of community education that we would want to take part in is the health classes that they have in their high school. So we'd want to audit the health classes taught to ensure students are being educated on important things. Health is a required part of the curriculum for high schoolers in Arkansas. And so we just want to make sure that in class they're being properly taught about the dangers and the risks of smoking that affect their community. We need to make sure that these students know how to take responsibility for their own health. And we also need to make sure that they know the importance of seeing a primary care practitioner regularly, especially as they're becoming adults.
Absolutely. And as we've mentioned, the county's high smoking rate drives these presentable disease occurrences, cancer and heart disease and such. So we want to start a free community program with group counseling and therapy, with free or reduced cost nicotine replacement therapy items like nicotine patches and gum and lozenges, and focus it to youths in the area on the back of Arkansas's already established Not on Tobacco program. I'm going to partner with the two medical centers and the Department of Health for these therapies and for the staff, and sort of hold them in local areas and promote through local communication channels, and fund it through our state tobacco settlement grants, and track quit rates and have internal thresholds for success. Anticipated impact would be a reduction in smoking rates and tobacco-related deaths, and to improve overall health equity, and essentially empower the county to quit smoking and live healthier.
So Emma, Spencer, and Haley have done a great job outlining the need for greater screening and some of the existing programs. But to put it all together in a formalized program, we want to build partnerships for education, screening, prevention. We will do this by assessing the current knowledge, engaging with the stakeholders and find out what they need, partner with the local government organizations as well as the corporate leaders, and then go back and evaluate it and see how we're doing and see if we need to change anything. So we're going to address this on all three levels: primary prevention, secondary prevention, tertiary prevention, because we know that early cancer diagnosis can and will save lives and lower costs. So for primary prevention, it's all about education, and we'll do this through the schools and school nurses, not just the high schools, but also the adult education through the VOTEX, and also through the civic and community groups, and then the existing Mississippi County health units. For secondary, it's all about early detection and screening. So as discussed earlier, we'll do that through the employers, setting up mobile screenings through community centers, and then also getting the buy-in from local government to help talk about this and get the word out to the community. Tertiary prevention is the early diagnosis and treatment, catching something early before it gets too advanced. So we would partner with Great Rivers Medical Center for follow-up and specialty care, Osceola Clinics for the chronic disease management, and then also the local health units through the Arkansas Department of Health and the regional offices for evaluation and reporting efforts. So how do we do this? We have to pay for it. Feel like we can get some government, corporate, or private funding for this. Initial pilot program would be about $50,000. That's taking some part-time FTE for a community health worker or a grant administrator, insurance navigator, setting up the mobile screenings, the diagnostic vouchers and transportation, because people have to be able to get to the screenings, and then the printed materials. Cost, if the pilot's successful and we want to expand this, the estimate's $100,000 for a full-time community health worker or grant writer and insurance navigator, and then expanding on the mobile screenings, doing more of those, and just more of everything on it. The reason we would need to scale up is the savings to society. It's estimated that savings of $60,000 to $85,000 per cancer case based on differences in treatment costs by stage. It stands to reason that if you can diagnose early and treat early, especially when it's in a single organ before it metastasizes, there's going to be a cost savings. And also expanding insurance coverage of uninsured or underinsured. It's estimated $500,000 to $1 million can be saved if we could get 325 to 650 currently uninsured persons enrolled in an insurance plan. That's about savings of $1,500 per person. And then preventive cancer screenings are required and covered by the ACA, so no cost sharing, another incentive for residents to get screened. So what happens if they screen positive and now they're a newly diagnosed resident? Then we can help them with insurance navigation through ADH health units or community health workers to determine if they're uninsured or underinsured and get the proper amount of insurance for their diagnosis. And then healthcare access. We would partner with Great Rivers Medical Center and the Osceola Clinics for follow-up care and specialty referrals to treat their new diagnosis. And then the Arkansas Cancer Coalition, American Cancer Society. So wealth of resources for people. But we also need to treat them psychosocially, support groups, and networking with others. So we would partner with the churches and civic groups and local support groups, and then get them information or get them connected with the Arkansas Department of Human Services for social support programs. Some of the educational materials would come from the health department, the CDC, and American Cancer Society.
And these are our sources. And that's our presentation for Mississippi County's health program.